Welcome back to Stark Lane. Today is our very first Career Paths podcast episode, where I'll be joined by a friend of mine, Elissa Shelton. Elissa is a corporate level business development executive who I've known for many years, probably a decade. She's got a tremendous track record of success in long-term acute care hospitals, inpatient rehabilitation, home health, hospice, even skilled nursing. So, I'm quite confident that her insights will be helpful for all of us, especially for those of you who might be considering a career path on the referral development side of American healthcare. Let's get to it.
You are now listening to the Stark Lane podcast.
How long have we known each other? Or should we admit that openly?
Right. No, like the other day yesterday I had to get in a group like over 40 and under 40. And I was like, where am I going here? I think at least 10 years. I mean, it has to be 10 years for sure. Yeah.
Yeah, because I've seen you hands-on, like leading functions in home health, hospice, long-term acute care, inpatient rehab, ARUs, I'm sure something else.
No,
SNF,
that's it.
skilled nursing, nursing.
Oh yeah, SNF. That's right. Yep.
Yeah. So that's a pretty big segment of the continuum if you think about it.
Yeah.
So how did you fall into this field?
Oh gosh. Okay. So, kind of a cool story if you're like a nurse on the floor, because I don't think that that is taught in school, nor is it something that you readily know about. So when I moved I went to nursing school, I was a nurse on the floor, did some contracts and stuff. When I moved from New Orleans to Texas, there's so many big companies in Texas, like we know, right? Memorial Herman's, the HCAs, all the things. So I didn't really know where I wanted to work. So I took a contract for a period of time and I loved it. And that was an LTAC. And so I just loved the levels of care, the level of care that you can be, in the ICU critical all the way to med-surg and tele-patient where you're getting ready to discharge. So, and you also really get to know the families. So I love, people, and I got to really know like their life stories. So I was a nurse on the floor in there doing contracts, in the ICU and the step down unit and stuff like that. And they had an opening in the sales department. Well, I didn't even know we had a sales department. So there's that.
Yeah.
I used to see the suits walk through the hospital and be like, who are these people? And why are they dressed so nice? And like, what do they do? You don't think about that type of stuff, like the inner workings of the corporation of how it works. So anyway, one of the doctors came to me and was like, hey, I think, you should think about the opening in sales. And I was like, what are you talking about? I'm already in sales. Like the patients ask for me when I come on and like I pick up extra shifts to work with, this patient or that patient. She was like, ding, ding, ding. That's why you should be in sales. And I was like, I don't even know what that is. And so she had the director at the time come and talk to me. And in my personal life, I was a single mom. And so I, was doing shift work where it was really hard. I didn't have any family in Texas. And so, the director came and talked to me and I was like, this sounds so easy. Like I could do this in my sleep because I'm already a nurse that's taking care of these patients. All I have to do is tell them why they should come and let our nurses and doctors take care of them. And so I was like, I can always go back to the floor. Like there's always a backup plan. I'm a nurse. Like I can do anything. And so, I still remember the first people I worked with and I loved it right away. Like I loved being the one to go into the room and say, okay, when you get, you have choices, here's the reason why you should choose us. And then when you get transferred to us, here are all the things that are going to happen. And it was like, I got to give that family and the doctors and educate them that sense of like comfort of what's coming next, because these patients are critically ill. Typically something major life-changing happened to them, which is the reason why they needed to go into that next level of care. That was 30 plus days. And so I just excelled. Like it was like just second nature to me. And so I did that for, oh my gosh, a while, and then kind of worked up through management through then and like did some preceptorship of like training the new people coming on and, understanding and like how for them to position how to get patients buy-in on consenting even to transfer to a different level of care. So that's kind of the beginning of how I got here.
That is and that's so funny. And that's such an awesome point too, because, as a clinician, you don't go through school thinking about, hey, I want to go into a sales gig. And there's such a negative connotation amongst a lot of people, including clinicians, about sales. It's not, have I got a deal for you? You're not approaching people in the street saying, hey, come get really effed up and stay in my hospital for 30 days, right? If you ever get really, really, really messed up. No, and it's such a service. You have a very targeted audience. You're not really selling, yet technically you are, but I mean, you're providing such a service to those case managers, to the social workers, to the families, to the physicians, just letting them know what is available to them. Because like a lot of families, in acute care, like when you find yourself in that situation, the ICU or whatever the case may be, you're like a medical hostage. You're there. You don't know for how long. You don't know what comes next. So having someone like you come in and explain what's going on in a few different options, I think it's pretty cool, and it's an awesome career path.
I think for all of post-acute, and this dawned on me pretty quickly, is like, but especially LTAC, right? Like, you don't know you need it until you need it. So there would be no reason for you to have this background of information unless someone you knew or just someone you knew or a doctor or case manager or something had that knowledge and had sometimes shared it with you. So it's literally like learning about something that you didn't. Unfortunately, the other bad part is that's not something you ever wanted to learn about because something catastrophic happened to you or your loved one. And so there also has to be that empathetic side of saying, I totally understand where you are. Let me tell you about, the success stories that I've seen that, I had a patient a year ago or whatever. And so it's also it's funny you say that because I always thought that like sales sounds like I'm trying to sell you a car with a 17% interest rate or something. I'm not. I'm trying to convince you that you need this and that your outcome will be better because of it. So I think that's a great take on it too.
And you are very, very modest, by the way. So since then, and you went into management, I mean, you've led some pretty massive teams. So if somebody's good at this, right? If they're a good liaison or an account executive, depending on the level of care, what could they do with their career at that point?
So I think from the first step is like look for those opportunities to be that mentor, right? Like have those conversations with your boss and say, hey, I do want to look into doing something different. Like I would be interested in that. And to me, that's critical as a leader because you always need to be, we call it bench strength, right? So you always need to be growing that bench strength behind you. So I try to find people on my own, but I also always love if someone comes and says, hey, I want some exposure. So some of the other things that I did was like, and my most recent role is we had these quarterly business reviews. So I would give them like some of the stuff we would look at and say, how would you present this? So let's work on presentation skill. Let's work on have to know how to manage up. So I think just having those conversations is definitely one of the ways for sure. I mean, I think that's the biggest thing is just letting someone know what your desires are, right? And finding someone, it doesn't even have to be in your space, right? Because for me, and I tell my employees this all the time, is the more exposure I can give you, the more cheerleaders you will have behind you. So if you're me or if you're a rep and you love analytics, you could go into analytics. I just have to figure out how to open that door for you because mostly all large post-acute companies have some type of analytics department, right? And there are people that are just better at numbers. So if that's something you want to do, then look for that avenue to work on a pilot program or to work on something that is analyzing data that will be driven down to the field and say, okay, well, I would be the end user. So let me talk to you about how I would use this and try to get your foot in the door that way. I think those would be the biggest ways.
So if you are you're thinking about building your bench and you're looking at, a lot of the people in the field, what do you look for? What are those sort of tells that somebody's going to be good in the referral development game? Who do you tap on the shoulder?
Yeah, love this question because when I get it asked in interviews, I can't remember. The other day I was like, how many interviews did I do last year? I'm gonna say over 100. And like I distinctly remember the people that I interviewed that I'm like, oh, that person's gonna be good. So I think there's a couple of things. I think the biggest thing is to be an opportunist. I have a doctor that I still, when I see him, he laughs about something I did. But I was looking, I was looking for, he was elusive, right? Like I was trying to talk to him and I was a director and I was with one of the reps and the reps could never get a meeting with him. So long story short, we were looking for him. I saw him up across the parking lot in the hospital and I was like, oh, I don't care. I'm running over there. And I had a skirt on and heels and my hair was in a ponytail. And he's like, all I saw was your blonde ponytail doing this. And he was like, she found me. Great. But I mean, like we have a great relationship now, but it was because I took that opportunity and I didn't say, oh, it's hot or I have another appointment, like whatever it may be. Like you see that person and you need that minute, right? You have your elevator pitch ready. So I think it's always being an opportunist. And then I think being a hunter would be the same thing. But when I say a hunter, I mean, you're looking for your own accounts, right? Typically, when you come into this book of business, you're given, no matter what level of care you're in, a book of business. Typically, someone's already been in that position or you're a growth position. So if you're either way, though, right, you're the person that is, you have your book of business, you're driving by, you see a new sign for Dr. Catherine Brown, who is opening and says, oh, no one's assigned to that doctor. I want that doctor. I've already looked her up in, Trella or whatever analytic system you're using and quantified that source. So someone that's always looking for that next opportunity and hunting the business themselves. And then I think the last thing is really a people skill. I mean, there's 100, but I'm just going to tell you the top 3 is a people skill, someone that can work collaboratively in a group, because in this setting, in any post-acute setting, you're always working with operations and you're always working with clinical. So you have to be able to problem solve for the positive story. You have to be able to problem solve for the negative stories and then have the ability to tell the positive stories with your coworkers if needed. So if you're going out to an account and you have a great patient that had a great PT outcome, ask that physical therapist to come out with you. You have to be able to have and bridge those relationships to make your story as strong as possible. So I think that would be the other thing.
Awesome. Yeah. So when I talk about a role in referral development, even if it's at the director level or above, essentially you have, 2 jobs and one of those is cultivating and nurturing relationships, so a lot of people are really good at that naturally. And I've seen some introverts who are very good at that, even though they're not people, when they're on, they're on. And, that is their game. They're thinking about it. They have an inner circle and that inner circle is super, super important. So I
agree.
You're a clinician on the floor. You discover this awesome new field where you can live out in the field, visiting other providers, talking to patients and families and case managers and social workers and physicians. What's the downside of this role, this type of field?
Oh gosh. Okay. So there's always one more call to be made, right? You're in the hospital. It's 5:00. Your kid has a soccer game at 6:00. You still have to pick them up. They have to get their things together, all the things. But you could make that one last call, right? And that one last call might be a 20-minute conversation. So you have to have good time management skills. And for me, and I think it's really important, and I stress this with my staff, is you have to have work-life balance. So you have to be able to have a point where you can say, I will find this person tomorrow. I'm going to add them to my list tomorrow. I need to be there for my kid or my husband or whatever it may be. So I think that would be probably the biggest thing. I think the other thing is we're in healthcare. We're all humans taking care of humans, right? I have had employees that get very jaded if we don't have a great outcome, right? Every hospital, every physician, every skilled nursing, every person that takes care of humans hasn't had an optimal outcome at some point in time, whether that's a nurse that forgot to give a medication or, they didn't catch sepsis right away and it ended up in a bad outcome. Whatever it may be, is the sales people can take that ownership and it can taint their vision of what it is that they're supposed to be selling. So I used to always say, it's like, if you're giving negative feedback, you have to make that sandwich, right? Like, you did something great, here's something you need to improve on, and here's something you really did really good today. So you have to be able to reconcile those situations that every patient, every doctor, every case manager, every nurse is not going to be perfect every day, because they're all human. So you have to have that grace mentality of like, okay, I need to go talk to this family now because we missed the med and they're really angry, but there really wasn't a bad outcome. We missed the med because we're humans. So you have to have that reconciliation standpoint. I think that would be one of the other pitfalls. Is just, again, because you're working with people all day, every day, and sometimes people suck. And you have to like go home and say, that wasn't about me. That wasn't about me. That was about whatever happened today earlier for me. And I still need to go back, next week or whatever it is, and have that conversation again and make that call again. So I think those would be two of the biggest things. So work-life balance, and then being able to reconcile and keep selling, even if it's not always 100% perfect.
That's sage advice, because, as when you're out in the field and you're the face of the company and you're, selling services, the perception is you're supposed to be super positive all the time. And let's say hypothetically, you're in a field like long-term acute care where you're taking patients off a long ICU stay. They're very, very sick and messed up. And, you don't have a positive outcome every time, but you're doing the best you can to give them the best fighting chance, right? And so I think, staying positive there and representing the organization well and all of your competencies and capabilities, that might be hard if you some of your patients that you've developed a relationship with, have a negative outcome. So, that's good
so
stuff.
I thought of something else that I'll say, because I think a lot of people don't think about this, but especially when you come in and you're like, oh, I'm just so green and naive and everything's sweet and there's rainbows and unicorns. You have to play nice in the sandbox. Every one of these levels of care have competition a lot, especially if you're in, the big metro markets in the United States or anywhere. And if you go into a sales call talking negatively about your competition, that's not great, right? And so some of my closest friends still to this day are my competition. And we still have a great relationship. Like, we'll ask each other questions, and if I know something that will help this person, then I'll tell them. So I think that's the other thing, is like, always be engaged in the market, know who your competitors are, but play nice. Like, we're all here to do a good job for our community, for the patients. So. Well,
and not only that, but mergers and acquisitions activity, the toes you step on today might be connected to, something you have to kiss later on.
I've went through 5 now, and I could tell you some stories. That is such a valid point. Yes, it's such a small world, and you never know. So, yeah.
And what's crazy now, something that I didn't see 10 years ago are line staff level liaisons, account executives who are now subject to non-competes. A lot of companies are pushing them out to every single person driving referrals. And I think that's fairly new in the last 5 years or so. Have you seen a lot of that as well?
Yes. I have seen a lot of that. And it becomes, depending on your territory, it becomes very hard as an organization to try to work around that non-compete. So if you have, if it's, because I've seen some from 25 miles to 75 miles. It really just is kind of company specific. But what we typically will do is try to work around the accounts to say, okay, well, we'll map it out. And all of any of the ones I've worked through have to go through legal first. So yes, it is challenging, which is then why some people end up in different levels of care, right? So I do think that I have seen that definitely step up quite a bit. I know there was some legislation that's still pending about, getting rid of them. So that would be really interesting as well. I don't know. I have a lot of mixed feelings about it, just because I understand it, but I also think people have to make a living. So, but like I said, there's other opportunities. I mean, I went into other levels of care partially for some of those reasons. So it's also good to learn other things and be open to other opportunities.
I think whenever I'm talking to people about non-competes, it's the phrase I always hear is, well, it doesn't hold water in, interstate, right? In Texas or what have you. And, that may be the case. And if you look on starklane.com on our blog, I have a very, very long article about non-competes and the legislation that came down federally, essentially banning non-competes and restrictive covenants for just about anybody except highly compensated and senior executives. But even if your non-compete is not enforceable, you may end up spending somewhere between $50,000 to $250,000 to find that out in a court of law.
Yeah.
So, and nobody wants to deal with that. So I think that's something to be mindful of. If you do want to go down this path, know that might be something that you may be tied, you may be subject to. I mean, I would say, I would always challenge an employer and say, okay, do I absolutely have to sign this?
Right. Yeah.
Okay, well, I know this is 2 years and 50 miles. Can we reduce this to 6 months?
Sure.
I have no, and I have no.
You're in sales, right?
Yeah, absolutely. Start practicing those, asking the right questions ahead of time. And,
right.
And it is commonplace. I've seen just about every organization has them. Some don't, and I'm not going to say whether it's good or bad because there are trade secrets. There are key contacts. It's a small market. There are practices that are proprietary that are developed by certain organizations. And you don't just want to give those away. So I get that. But, and to your point, people have to earn a living.
I don't think I've thought about this until you brought it up, but I was like, what has changed? I think one of the major things has changed is the amount of analytics that are driven down to the field level. So, 5 years before that, it would have been my job 100% to gather the analytics and to come say, hey, Ryan, you have 5 accounts that are not producing. Here they are. Let's set some goals on those. And this is what they're sending to their competitors. But I've done that research. Whereas now they have these large companies, you probably know one of them that I'm talking about, that are creating it down to the rep level where on their phones, they have access to look and say, okay, well, here's facility B or Dr. B or skilled nursing B, and here are the top 3 people they send it to. Here's their quality scores. Here are their rehospitalization scores. So they literally have all of the information that they need to go to competitor B and know what competitor A does, because I worked for them already, and create a plan to take that market share. So I do understand it from that point. But I think that's one of the main things that's changed. And I didn't actually put that together till you said it. So,
and the technology that goes into those analytics, that is not cheap and certainly not free.
Nope.
We have a lot of that technology. Well, we have all that technology here, and I know what I pay for it, and I'll protect it. I can assure you.
Exactly. Yep.
It's funny. We're talking about career paths, and what you do is so highly tuned in and tuned up for an organization. It's so valuable because I talk to CEOs and CFOs all day long, and they beat their chest and they're so good and they do this with their organization, but they wouldn't have an organization if they didn't have patients, right?
Sure.
And so I also have other clients who will not hire a CEO for a hospital unless they have some form of business development in their background to develop their people skills. Have you ever encountered anything like that?
I don't know that it's ever been a hard and fast. I do think that I have seen the shift, especially in post-acute, to where it's not necessarily the education behind your name or whether or not you went to Stanford or, name a big university, one of the top 4 or whatever. It's more of what have you done in your past that's made you applicable to this role. I can tell you some of the best partners I have operationally have 100% have business development background. So they understand that if we make a decision operationally that affects our referral patterns, it's not my SVP, my current SVP says, it's not a water faucet, guys. You can't just turn it on and off. And so she understands that because she was in business development for a little while, but she also trust her partners. So I think just having that background gives them, they don't function in a silo, right? So when you're thinking about CEOs and CFOs, it's top line revenue and then maybe top line expenses and all the other things. It's not all the minutia that had to happen to get there, and what are some of the reasons that we didn't make those numbers, and are able to articulate it from the business development standpoint, right? So all the things that could happen. A hospital partner opened their own home health. Okay, well, now we're number 2. So we're the best second choice. And now we need to plan our budget around that. And so I think just having all that information does make those people definitely a better partner. And I think the more varied you have in your background, right, not a year of experience, but 3 to 5, makes you a better applicant no matter what, because you have done more than one thing and have an understanding of the total business scope, not just the finite thing that you're responsible for.
Yeah, I can't think of anything else. Another place in the field. You touch so many aspects of the business, including managed care and reimbursement. I mean, you can't be completely ignorant to that because not every patient is the same. And, so you learn about DRGs, you learn about, all of that. And so I think it does. I think it makes you better all the way around. And certainly, if you're not committed to business development, it'll illuminate, I think, a dozen other paths for you from a career perspective.
Yeah, absolutely. I actually had a couple of things written down because I was like, when you think about being a clinician, what are some of the other things that you could have done, right? And some of this is hospital setting and some of it isn't, but from being a clinician, there's the case management route. So that's obviously, right, typically a clinician, they're managing in an acute care setting or a post-acute setting, because most of them have case managers as well, billing the stay, all the things that are happening with the patient. They're coordinating with social work to find the best discharge plan for those patients. And then I was like, okay, what are the things in all of the other levels of care? If you have a nursing background or a PT background or any type of clinical background, what are the things that you could have done? So I'm always thinking about director of nursing. So that's, the person that's over the nursing department. Then you have quality. So those are 2 totally different things. That's one person dealing with the nursing aspects, with scheduling and staffing and all the clinical things. And then the quality person that is so much on the forefront these days with value-based purchasing and everything else that's happening, as quality is, they're going to be
who would have thought
positions.
Your paycheck as a hospital can be determined by your quality score, right?
Yeah. I remember sitting in my first ACO meeting in Houston, and I was like, oh, this is going to be a game changer, like for real. And at that meeting I was sitting in is one of the most profitable ACOs in the whole country.
That's awesome.
On the forefront. Yeah. So, and they have great quality scores. So it's being backed up. So provide good quality and get paid for it. I mean,
and going back to all these different career paths, and you're a clinician and you're looking at these things, when you go into business development, there's one thing that does kind of stand out. The money can be pretty good if you're good. If you're not good, you'll go back to the floor. But if you are good, I think there will be opportunities. Generally, there are incentives, based on your effectiveness. But then, a lot of times those incentives and that comp, they're tied to the downside. You're going to have your restrictive covenants, things like that. That's one of the reasons it's so lucrative, especially as of lately. It's just an awesome career path. We need to, I love talking about these opportunities for people that they don't know existed.
Yeah, I think, and I wanted to say something else too, because I actually say this in my interviews. So when we talk about so there's a lot of different terms, right? You can say a clinical liaison. That's a word that a lot of post-acute settings use. You can say account executive. When the word account executive is used, that doesn't typically mean that the person is clinical. So I know I'm talking a lot about clinical because I think in the scope of being involved in patients and talking to families, of course, you're going to have a little more knowledge, right? But this is something I always say in my interviews is, I don't care if you're a nurse, if you have the personality of a potato, because I can't teach you to have a good personality. However, if you have a personality that's people want to talk to you and you're just glowing, and I can't teach that to someone. So I can teach you how to look at a chart. I can teach you how to know what COPD means. I can't teach you how to be someone that when you knock on the door and they see your face, they're like, "Hey, Ryan, good to see you today. Like, what's going on?" That's not a teachable thing. So I think I'm saying that to say, like, if you think you have a great personality and you love talking to people and you love selling, like, don't be afraid to put your name out there. Don't be afraid to interview for a position and look at the job listing and say, well, what have I done at insert name? I'm trying to think of someone I've hired from outside the industry that was just, I had someone that worked at a flooring store in Florida, like literally a flooring store. And then I had someone else who he was like 25, graduated from college, and he did sell cars for a little while. And then he worked at Verizon. I was like, where did he work? Those are two of the best salespeople in those markets that we hired, because they have the personality that opens doors. So I say that again to say all that, to not limit yourself. Just if you don't have a clinical title behind your name, still try it. It's like you said, it can be very lucrative. Incentives, base salary. Some companies offer fleet cars, so you don't put all the miles on your cars. Just depending on what level of care you're going in. So lots of opportunities for sure.
It's a very good point. Whenever you're reading a job description, I encourage people to use it as a reference point and not a be all end all. Don't let, one or two bullets of requirements prevent you from putting your name out there. And also, like, if you have that is in your DNA and your personality, and you know how to drive relationships, don't just put a generic resume on a posting. Go get that sucker.
Right. Go to networking events. Don't just send it to this large organization that it's going to one of the companies I worked for literally used like an AI program to pick out those 2 qualifications. And if you didn't have it, you didn't even make it to me. So you didn't make it to the person that screened to send to me. So I would say, if you're in an environment where they're doing network events, like, look for those, look and see what those are. Go to Chamber of Commerce events, just find ways to make those connections, to make it a people connection and not just your name on a piece of paper on a generic resume. For sure. I think that's a great point.
And I would also tell people to don't be intimidated by the most senior people in the field. The people you might meet at one of those networking events, you never know when they might be like a senior VP,
Yep.
out there scouting and looking for talent, because they know,
sure.
they know what drives their company, and that's the people in the field at the local level.
Yeah, that's literally bench strength. I have someone in Florida that on my last review of her, I was like, she's a hunter for her own employees. Like, she does not wait for recruiting. She does not go to LinkedIn. She does not go to Indeed. She finds people in the hospital. She actually we had a scheduler position, and she found, this girl worked at like a coffee shop, but my employee went to the coffee shop all the time. And she was so great. And she was like, I don't know, she's talking to her about like, what do you want to do and all that. Ended up hiring her for the scheduler. She's amazing. Like, she's great. So yeah, always be open, as you said.
And the market, the market, I think, as well as anyone out there, even though you tend to be pretty focused at your task at hand, which is usually a very big lift. But so kind of leveling up a little bit. So say somebody's been in their career a while, they've been successful as a liaison, as a director, they've run maybe a hospital or two, or a market or a region, and they're thinking about, their new mountaintop. They might be subject to a non-compete. They might have to change levels of care. And I think if you've been successful at that level, you can write your own ticket. You can go anywhere. You can go to psych. You can go to rehab, LTAC,
IV, infusions. All things.
Yeah.
Yeah.
Where do you see the most opportunity right now and the most growth without, without like the competitiveness of, say, hospice that is, I wouldn't recommend anyone go try to break into hospice as a leader unless they've got a lot of expertise, right? But there are other places where there's a ton of opportunity.
So I think for sure home health, because you have the top 2 or 3, which are that the top is shrinking. So there were like, five big names 4 years ago, and now obviously they're being bought up. But there's still tons of mid-sized companies out there. So there's still tons of private equity companies out there. So if you think about like what's growing, home health is still growing. If you look at value-based purchasing and where that's going, it's going to the lowest level of care that's possible, and that's home health. So I definitely think that's one of them. Senior living, I think senior living, those communities are not stopping being built. They're building more because people are aging, obviously, in place, and they want to age in place, right? So I think that's one of the other things. And for senior living, it's definitely a lot less clinically stringent than even home health is, because that's their home, right? So that's a really great place to like break in, even as an admissions director. I hear a lot about IV. So there's a lot of infusion companies out there. So I have actually a couple of people that I know that are one was a really great employee that I had that left and went to infusion, but she had experience there. She loves it. And so if you think about infusions, there's always specialty products that are being done. She's not a clinician. She's doing great. She's like in a mid-level position. Again, not a clinician. So I think that's another area that's just going to keep growing, because again, when you go to delivering care at the lowest level possible, that's going to also be, infusions in someone's home. So I think those would be the three big areas.
And behavioral health, that's still not going anywhere. That's one I'll add, because I think psychosis, I know it's a broad DRG, but that's been the number one DRG for like 12 or 15 years. There's a lot of opportunity there. They're expanding care to different levels.
I actually have two employees that one in Arizona and one in Louisiana, that both went into behavioral health, but more of the mental health side. So the counseling, all of that type of stuff. And it was and now I know that there are like at least five of these that I've done research on, but like a small company that was started by a very young person who had a personal story, and then translated that into the mental health space, where they are doing these amazing contracts with all these payers. And so you're not only looking at Medicare age people, you're looking at people my age that are struggling with something, and I need, that mental health provider. And we know that's, another hot topic all over the world now is mental health. So I didn't even think about that one. That was a great call out. And by the way, both of those employees love their jobs. It's just amazing. Like they feel like they're making a difference every day. And that's important.
That's awesome. Yeah, I do like the psych space as well, depending on the segment.
Yeah.
Some parts of it are very tough. Some parts of it are great with great outcomes. What's funny is you see some entry-level people and you see some very seasoned people, but not a lot of people in the middle these days.
I think you have to have a certain love for it. And I think you have to have a love of being the feet on the street, because that mid-level person is the person that is the one that's with the people that are just starting out. So I have a leader in Florida who, I love her to death. And I'm like, don't you want to be me? Like, you could be me today. And I tell her all the time, and she's like, no, ew. But she did try it. She did try it for a little while, for like 6 weeks, and she had a terrible experience, unfortunately. But I was like, but I'm not having a terrible experience. Like, I'm telling you, it's changed and you can do it. And she said to me, I love my job. Like, I love being in the car, going out with the reps, seeing them like, oh my gosh, I just got a referral. This is the best day ever. And then like talking about, how did you get that referral? What did you do? Or the opposite side, right? Which we never talk about, is like, well, that really sucked. What do you need to do different next time? How are we going to clean this up? And so she just said, she was like, I get it. I get that I can do it. She's like, but I'm also good at my job, really good at my job, because I know that I could do that, but I choose to do this because I love it. And she does. And you can just tell, like 5 days a week, I'm like, girl, can you have a home office day, please? I need an expense report. I know you have expenses. Like, can you take a day at your house, please? And so I think you actually have three of them in Florida. I'm thinking about, I'm like, I have three of them in Florida that are just like that. So like, what a blessing to have those people that do want to live in that space and are okay. And they're all like looking for someone to take their job or to take the next job that's open. And I've done that like 3 times in the last, like I had a rep and I had a area vice president position. And I was like, take a risk. They know the job. Like if you can translate that to someone else, then you're going to be a rock star. 2 of the 3 worked out great. 1 didn't. Okay, you're not going to win every time, but like they went from a rep to an area vice president. So
that's insane. That's huge.
Yeah. I mean, they're still kicking butt. And I was like, you have to be willing to take a risk sometimes. And again, you can translate, it's me, right? Like I can translate what I was doing into helping other people and teaching them. That's what it's about. Like, I'm not there to do the sales call. I'm there to help you. So I agree. I do agree that it's very hard to find those people that want to stay there. Because I think you need to have a balance of that. You need to have those hungry ones that want to come and take my job and work alongside me to get that opportunity. And then have the ones that they just want to be there and bring up the next ones.
Well, you brought up a very good point, is that you have a job and I have a job and we both love our jobs and we should probably get back to work at some point.
Right. Right. Yes. Do that.
Well, Elissa, thank you again for joining us today. And we'll catch you again soon. I'm sure on other fronts.
All right. Thanks so much, Ryan. I had a great time.
This has been the Stark Lane podcast. You can find us on YouTube, Spotify, and wherever you find the programs to elevate your career and your passions. Now, get back to work.